the Pathology poem rap by the CU Boulder Health class, and I'm Emily Brien, the writer.
AIDS is an acronym for disease caused by infected blood and bloody fluids, tipped off by fever, muscle pain, and rash, prevented by condom and clean needle stash, treated by arterials and ARVs too. If we aren't careful, the infected will be few. Mama sick with AIDS can pass it when they nurse, but if they take the meds, expect the reverse.
Right, cholera.
What is this cholera, you may well ask? Just set the silly stanza to its task. Poop and water will make you sick. It'll make your insides sloshy slick. The sickest you won't make it through without water, antibiotics, and a cleaner loo.
Gangrene is what happens when the wound goes unclean. It changes its color and it smells obscene. To prevent it, it's easy, just keep it clean and dry. Without antibiotics and surgery, the patient may die.
Yo, yo, yo. Okay, so here's the thing about hepatitis. It comes in many different forms, just like meningitis. There's hep A, hep B, and yup, hep C.
Each and every one will give you liver disease. Infected food and water will get you hep A. Dark urine, fatigue, loss of appetite means hep A, or are on their way.
B and C are contracted through infected blood or sex. And they sometimes look like A, but B can be symptomless. Vaccines make prevention easy for A and B, but to prevent C, you need caution and monogamy. Yeah.
Alright. Protein malnutrition leads to quashular colon.
Tiny muscles, bloated bellies, treatment problems, what's in store.
A well-balanced diet will keep the condition at bay.
Cheat with calories and proteins, eating more every day.
Malaria is a disease you may have heard it said. Travelers contract it without sleeping with a net over their bed.
Mosquitoes carry a parasite and infect a person's blood, but antimalarials and bug spray can make their plan a dud.
Fever, chills, and sweating are symptoms that define it, but high-dose antimalarials are pills that will defy it.
I haven't had the measles because I've had the vaccine. If I hadn't, I could get it from coughing or sneezing. First a fever, a cough, a rash, a runny nose, but NSAID and H2O can help you out with those.
Meningitis can come through a cavalcade of carriers, mostly person to person without proper barriers. High fever, headache, stiff neck, and rash. I'll help identify this infection in a flash. From Senegal to Ethiopia, the meningitis belt. Here the effects are most fatally felt. Bacterial's the worst, but lucky for you, there's a vaccine that'll get you right through.
We've all heard of tetanus, but what makes it tick? A contaminated wound might just make you sick. Lockjaw, stiffness, and painful spasms too. Preventable symptoms just to give you a clue.
Take the vaccine that blocks it. If you forget, take antitoxins or antibiotics.
There are two kinds of tuberculosis that y'all ought to know.
Pulmonary and extrapulmonary.
That's for sure.
They're caught the same way, spit, a cough, or a sneeze. Their symptoms are different, though memorized with ease.
Start with pulmonary.
Fever, cough, chill, and sweat.
Drop the cough, add swelling,
And extrapulmonary you get. The disease starts out latent, symptomless, but then when it becomes active, it's passed through the air.
Tuberculosis can be prevented through good hygiene.
Though in some high-risk countries, they'll give you a vaccine.
It's treated with one or more kinds of anti-TB medication.
The more resistant the strain,
The more complex the combination.
Typhoid's not like cholera, the way that it's contracted
through
fecal matter transmission. Poor sanitation will attract it.
The symptoms are high fever, headache, and fatigue. Hygiene, vaccine, clean water, prevention is no intrigue. To treat, there's just one sure bet.
It's all that they can do.
To give you antibiotics and a lot of clean water too. And there it is, the Pathology poem. Lest the disease shall be forgot, consult these nimble mnemonics, and the answer you'll have got.